Good afternoon, and welcome to St. Joseph's University's Unlimited Learning Expert Series. I'm Luis Nunez from the class of 2021, current graduate student in the Public Policy program here, and I'll be your moderator today. I'm joined today by our two experts, Dr. Crispin and Maureen Greene. Dr. Crispin is an associate professor of economics and director of the Public Policy program here at St. Joe's. Maureen is an assistant regional commissioner at the United States Department of Labor, more specifically the Bureau of Labor Statistics. I want to thank St. Joe's for coordinating today's event and thank all of you for taking time out of your day to attend. A key element of the mission is a commitment of lifelong learning. That mission led to the creation of the Unlimited Learning Expert Series and today's interactive discussion on the labor shortage. I'm sure that many of you tuned in today because you felt the effects of the current employment crisis firsthand. Later this hour, we'll discuss questions that you submitted in the registration and during the webinar. If you have any questions during the discussion, please feel free to use the Q&A feature below on your screen. And if you do use it, please include your name, location, and if you're an alum, your graduation year. So let's start off the discussion by setting the stage a bit here. What role has COVID played in disrupting the labor market? Dr. Crispin, if you don't mind starting us off.
Sure. So I could go on and on about this for the whole hour. I think so many aspects of the labor market have been impacted. So what we saw immediately, so the early initial stage of the pandemic, certainly virtual schooling and childcare centers closing, and that had direct impacts on working parents, many of whom were Zoom schooling their children while they were working remotely and trying to balance their work with childcare obligations. And so that certainly created some challenges for many households. We saw restrictions on immigration almost immediately, and that had implications for labor supply and has led to a number of different labor shortages that we can certainly talk about. And then certainly the increase in risk for many jobs. Jobs that were inherently less risky become much riskier initially in the pandemic. So that has led to a number of different implications. I'm sure we're going to be talking about those. As the pandemic has sort of worn on, we see a lot of long run unemployment. I think Maureen will probably show us a bunch of slides about that today. And that's led to many discouraged workers who have left the labor force after a very long spell of unemployment. And then certainly we saw early retirement for older workers for various reasons, pandemic related. And so that's just a few of the different factors that, that I've sort of been tracking as this pandemic has been going on.
So actually, I do have lots of slides. As Laura said, she could go through for an hour. I decided that I could probably teach an entire semester. So you're not going to get as many slides as you might ordinarily get because there are a lot of things. This covers the waterfront in terms of the number of people that are impacted by different things, the industries, the occupations. So I'm trying to give you a snapshot of this, but I will tell you that the Bureau of Labor Statistics has a lot of data that you can access, and I will be happy to point you in some of those directions. But I wanted to show this slide really is the slide for what happened. It was like the economy hit a brick wall, and all of a sudden, from one week to the next, we just had a collapse in the number of people who were employed. And this is really kind of an unprecedented situation. And if we move to the next slide, but before we do that, you can also see we're beginning to come kind of peak right back up again, which also is an unprecedented look when you normally look at recessions. So if you go to slide 3, this is not the most up to date. That red line could have continued up a little bit, but I thought this was a very evocative picture of what normally happens, as if recessions are normal. But there are some patterns that recessions have. You can really see red is the COVID recession. It does not look like any other line on this graph. The other recessions tended to gently dip down and then gradually come back up. And you can see none of them had the really catastrophic and immediate, nobody went anywhere near the percentage of jobs lost that this most recent recession did. So this is not, your father's, your grandfather's, your grandmother's recession. This was a very different animal. Mainly, it's because past recessions disrupted employment almost entirely due to the demand side, which means that the employers cut back. They said, we don't need so many people, money's tight, gas is expensive, whatever caused the recession, it was they made the decision. This time with COVID-19, it's very unusual because it did that, but it also disrupted the labor supply. And that was due to a number of things. The health concerns, certainly a big one. Family demands, also a very large portion of this. And then government policies. And these were all very novel situations. And this will play out through the rest of the slides you see, because these are not things that you normally see. So right now we have two things that are coming together. We have supply and we have demand that are both, kind of mucking with the labor market. Next slide. The other thing that's been very remarkable is how quickly, and it doesn't necessarily feel like this, and this is one of the things where a lot of times when BLS brings our data out to St. Joe's, I often say that we're like Joe Friday. We're just the facts. I can't dabble in policy. We just have our numbers and we stick with them. But a lot of times if you listen to the news media, and I'm not taking anything away from the news media, I'm not saying they're false news or anything like that, but the sexy story is not necessarily what's really happening. They're going to find people that exemplify things and they're going to push the story. The reality is, as of October 2021, which was the most recent data we have, it was just released last week, we have in many of these industry sectors, jobs are snapping back. We're really almost to the point we were before the recession began, before everybody was sent home. In fact, in at least one or two, in particular financial services, that they lost jobs and they brought them right back. So you can see the red line is the share of jobs. I'm sorry, it's the net change, not the share. The net change in jobs that were lost. And then the blue is how many jobs have been regained. So most of these numbers are really pretty close. But then you get to some that aren't so close. Leisure and hospitality being one of them. So you're starting to get an idea that this is not even. There are things that are different sector to sector, and that's going to be a big part of the story. And now I just want to quickly go through some individual sectors so you can get a feel for that. Remember that first graph that showed that big line going down. So on slide 5, we have retail trade. And notice that has that same really big decline, and then it's coming up. But take a really good look. Notice that way before we hit the beginning of COVID, way before March of 2020, the line was already beginning to slope down. Okay, this was not a robust and growing industry. So things were being lost. And yet, if here we are, and you hear about retail trade a lot, because they're having trouble finding people. There's just issues with retail trade. Yet when you look at the side past COVID, if you look at up to October 2021, you'll see that we really are almost back to where we were. So the story doesn't necessarily match up with exactly with the data. The next slide. Now here's a different version, okay? What happened as soon as everybody got locked in their houses? And it really wasn't everybody, by the way. What happened is we started ordering things, right? And that was how we got a lot of stuff. We got groceries that way. We got all of our clothes that way. We got cleaning products. So transportation and warehousing did have an initial down, but look, it was nowhere near as deep as the declines in some of the other industries. And it is now even higher than it was at the beginning of the pandemic. But also note that that long run line, like take the line all the way from January of 11 and just kind of imagine a line that excluded the pandemic. And it looks like that they pretty much have just picked up where they left off. That line looks like it would continue to where we are October 2021. Next. And then we have financial services. And one of the things that is going to be really important to understand is that things are not just different because of what industry you're in, but also who the industry tends to employ. And financial activities also has regained. So they had the little dip. But financial activities tends to employ more men than women, tends to employ people with higher education, and it tends to employ people who had jobs that were really telework eligible. You know, there are a lot of people that really couldn't telework. I think one of the misperceptions is that there's lots of telework going on out there. Well, there's certainly a lot more than there used to be, but many jobs, in fact, most jobs are pretty much defined as being jobs that you really can't telework and do. So imagine, you know, you have firefighters, you know, they can't telework. They have to show up to fight that fire. You've got people in hospitals. Well, the HR people may be able to work from home, but the nurses aren't going to be able to work from home. Plumbers, you know, you go through, think of all the occupations that just will not be able to turn into teleworkers. And the presence of more of those people in different industries really has a powerful prediction on how this recession hit them. The other thing is that with those characteristics like financial activities, they're higher educated, they're more male, they have these, they also make more money. And one of the really important connections between people who could telework is that they had more money. So you think about the people who couldn't telework, and they're going to have those bigger drops in employment. They're not making as much money to begin with, and they really are going to be more exposed. So that story is going to continue through. Next slide. This is one that I think puzzled many people. During the midst of the pandemic, when hospitals are building tents and putting people in parking garages and they're desperate for healthcare workers, they actually laid off a lot of people. Some of them were laid off because they were in areas that nobody was using because everybody was concentrating on pandemic patients. So they weren't scheduling as much plastic surgery as they were taking care of people. So it depended on what exactly you did. But also remember that everybody in healthcare is not a doctor or a nurse. There are a lot of people who are, you know, janitors and orderlies and patient transport and security. They're in that industry. And in many cases, they lost their jobs, and you will notice that they have not come back. I mean, they have a pretty good gap between where it was when we started and where they are now. Also in there, if we go to the next slide, you will see that nursing and residential care is really having trouble. It is not coming back. They lost a lot of people. This was an industry, it's low pay, does not generally require higher education, and was struggling to hire people long before we ever got to a pandemic. So they're not coming back, and that's a major problem for that industry. On the other hand, you see home health care services increasing. You know, it's a little early. We don't have a lot of good data, but it's not hard to imagine that some people are trading. I'm not going to put my mother in the nursing home because they got a lot of bad press putting people in nursing homes. So we'll find a way to take care of that person at home. That could be a real change in an industry and could signal change in who's employed and you know what kind of money they make. So if you go to the next slide. This is employment in nursing and residential care facilities, and you can see that it's just plummeting. And between September and October, it kind of pulled even, but it's hard to know whether that's an actual change. It was not significant. It was an over the month change of only 4,000 people. So this is a very small change. So this is something that you have to really think about when you talk about labor shortages and really the labor market in its entirety, is that there's so many layers that impacts what you're looking at. You have to think about what's the industry. You have to think about, you know, who makes up that industry, whether they were telework eligible. And all of those things are going to make some very, very different perspectives for you, for, you know, jobs that you may decide that you want, and for even your geographic area. Okay. And I think we have one more. There we go. Food services and drinking places also is getting a lot of publicity. And you would think that there was just nobody working in restaurants at this point because that's all you hear about, right? And yet they really have come back with, not completely to pre-pandemic, but they really have come back. So that does make you wonder what is actually happening. You can see that this was an area that had been increasing. Retail trade was not increasing, but people having money and spending them in food in restaurants and fast food places really was something that was visible income will tend to put their money to. So there is still a gap, but it's not as horrific as the gap that you would imagine if all you did was listen to the news, where every night there's some restaurateur saying he can't get anybody to work for him. Now, there are problems in that industry, and I'm sure that Dr. Crispin will go over some of the problems in that industry, but it may not be. I would say that the nursing homes and residential care is a much more critical problem than the restaurant problem. And then to the last one in this series, I think. Next slide. So here's another thing that we have to, this is a really, really different look at the labor force. And this is the aggregate. And we'll see in some later slides, the aggregate doesn't always tell the whole story, but this is a pretty scary discussion, the civilian labor force participation rate, which is the number of people who have a job and the number of people who are unemployed. And you should know that people who are unemployed actually have to have looked for a job. And the discouraged workers that Dr. Crispin talked about, they haven't looked for a job lately, but they have to have looked for one in the last 12 months. So there's still some rules about it. So lots of people are not part of the civilian labor force. They're not working and they're not really unemployed because they're not looking for work. So for instance, my husband retired in June. He retired a little earlier than he might have otherwise. Pre-pandemic, he was not planning on retiring then, but he worked in a hospital and he was exhausted. So he's actually emblematic of some of the decision making that people are going through. He could retire. He could have retired several years ago. He pulled the trigger. He retired. Well, guess what? You talk to him, there is no job you could offer him that he would be willing to take. So therefore, he is completely out of the labor force. So when you take the number of people employed and the number of people looking for work, he's not in those numbers. He is, however, in the bottom number, which is the total civilian population. So when you do the math, you get a labor force participation rate, which you can see the gray bar, the fat gray bar, was the last recession. During that time, it wasn't like labor force participation was always, just bubbling up and up and up. But you can see it starts declining during the recession, which often happens because there are people who will simply stop being part of the labor force. But then when the recession's over, what happens? We continue to decline and we go down and down and down into the mid-teens. And it had just started looking like it was pulling back up a little bit, and then COVID hit. And now look what has happened. Tremendous drop. You're going to see that kind of a line throughout many of the slides, and it is not coming back. So a lot of people are no longer part, not that they're unemployed, they're simply no longer part of that labor force. And that's not just a COVID number, although the COVID number made it drop, but this has been a worrying number all along. So many of the things that we're hearing about now acting as if it all started last March. No, did not start last March. Many of these things are long-term trends. Okay, and I think that's the last. Yes, that's the last slide for that question. Louis.
Yeah, Maureen, employees leaving positions clearly at an all-time high. Have we ever seen a situation like that in the history of our country?
That is such a great question. And when I was studying history, that would probably feel like a better way to answer that. Ooh, I just lost my screen. There we go. Okay. However, the way that we measure this is a fairly new program. New for BLS. Some of our programs go back to before the First World War. However, not the job opening and labor turnover survey. And this was actually an important addition to the array of information that we have, but it only came in the year 2000. We're a government agency. Somebody has to agree to come up with the money for us to do these kind of surveys. This was discussed for a long time before they finally decided to get the money together and start figuring out how to do this. A dirty secret about almost all statistics is that there is no simple, natural understanding of what these things are. in order to decide to count people as unemployed, they had to come up with a definition for what is an unemployed person. An unemployed person, as I said, has to have looked for work. Doesn't have to be all that formal. Might have just been saying, Dr. Crispin, are there any jobs at St. Joe's? If I did that, I would qualify as unemployed because I had looked for work just by asking her. Not really a high bar to jump over, but we have to come up with definitions. We have to have data sources. We have to validate it. So the history of the United States, I could say probably we have never seen anything like this before. We certainly saw with those other recessions that nothing looked like this, but I can only talk about the history of the United States back to 2000 for this particular, which is this is the number that people are talking about this last couple of weeks, which is the total US quits. Those are people that just came in and said, I'm done. I'm not working here anymore. Now, quitting does not mean you don't go get another job. Many people will get another job. So it's not like we have 4 million people just roaming around not doing anything. And especially psychologically, where you hear that, and it's not only here, we have more data you'll see in a minute, that there are jobs out there. Well, that certainly is going to encourage somebody that maybe is not too thrilled with where they're working or how much they make, or they have to work nights and they don't want to, whatever their issue is, that will encourage people to quit because they think that they can get another job. Many of our statistics, for years we've looked at people that don't think they can get another job, and people that don't think they can get work, whether they're employed or unemployed, they have limited prospects. But again, take a look at that long-term trend and exclude the dip down for the pandemic. And what do you see? You see a trend. So would we have gotten to 4 million anyway? Absent, kind of looks like it. That's certainly the way that the numbers were going. And you can see what happened in no great bars, but look back to 2008 and you can see that recession hits. People don't quit. They're afraid they're going to lose a job. They're afraid if they lose that job, they don't get another job. So you can see how people behaved at that moment, but then it starts going up. So people quitting is not the strangest thing to have happen when things are recovering. So in some regards, maybe it's a good sign. It's hard. Unfortunately, with most statistics, there's good and bad to all of them. With inflation, some people are spending so much money, but other people are making more money because it depends, where you are, whether you're selling stuff or whether you're buying stuff, it depends where you are. So it's most statistics are kind of neutral. They're agnostic on whether they're good or bad. So this one could be good. Who knows? Next. So here's another, we'll just quickly go through this. This is retail trade. Again, look, we have the same kind of pattern. It's a little rougher because it's a smaller industry. It's, just an industry, not everybody, but same thing. It dipped after the 2008 recession, and then it's been gradually going up. It is going up faster now, now that we've come back. But if you drew that line out, it certainly is in line with the trends we're seeing absent the pandemic. Next. The other thing that's very interesting, because jobs are not equally distributed, and that's one of the things that makes so many, there are literally like a gazillion different labor markets, because you've got to figure out where you are, what are the industries that are prevalent, do the location quotients, what are the industries that are driving. You hear about Philadelphia, eds and meds. We certainly don't have a lot of coal mining happening in Philadelphia, but there's coal mining in other parts of our state. So depending on where you are, the labor market can be quite different. So here quits, just to give you a rough idea, 2 states right next to each other. We drive back and forth from New Jersey to Pennsylvania all the time. Yet look, they're not the same, and they're not the same as the US aggregates. So Pennsylvania had a much more pronounced decline in the number of people quitting as the COVID period took hold. New Jersey just had kind of, really within kind of the band of where they normally go with their ups and downs, right next door to each other. So imagine how difficult it is. And we have this data for every state in the union, and this goes back a little bit. So you can really look at what happens in different states during different periods. And it is not just a monolith. Okay. Next one. Now, the other side, and this is the wonderful part, this is the part that was so new. when we started doing JOLTS, as we call it, which I love the fact that actually is a name, JOLTS, that has a ring to it to me. And that is the number of job openings. That was a piece that we had never measured before. And again, take out the pandemic and you kind of see a line where job openings, and that means it was a job that was open that was not filled. If it became filled, they would simply be an employee, right? So from 2009, that number of job openings that people were not filling had been going up. And it was kind of going down a little bit just before COVID. And now it just shoots back up again. So there are a lot of openings, and this is not the newest thing in the world. This was something that we've been seeing for the last decade. And I think that's the last one for this, right? Oh, no, I'm sorry. This is the last one. Unemployed persons per job opening. Now that's an interesting way of taking the two numbers and doing a little bit of math. And again, you're experts at this point, right? You can spot that 2008 recession. You can see how the numbers really spiked, where there were more unemployed people for every job opening. But that ended 2010, and then it precipitously goes down, spikes up again during COVID. But look at that last number, really in line with the pre-COVID numbers. So the idea that we do not have enough people to fill the job openings, or it's a very tight number. So you only have the people you have. And if people are not willing to move, and a lot of people don't like to move, they have the skills they have. If they're not going back and improving skills, it makes it difficult for employers to hire. And it makes it difficult for people that want a job to find the right employer, because there really aren't that many jobs for them to choose from. Or I'm sorry, there aren't that many people for the employers to choose from. Sorry, said that the wrong way. Okay, next we go to a different question.
Yeah, Maureen, I'll direct this to you first, but Dr. Crispin, I'd love to hear your thoughts afterwards. Has a labor shortage had a larger impact on women because of virtual schooling and like other childcare demands?
We can certainly, childcare is obviously an issue. It's difficult to completely nail that. We ask questions based on, were you not able to look for work because you were taking care of people in the household? And by the way, taking care of children is one thing, but taking care of other people in the household is also an issue. That definitely impacts women much more. And we do know that women with small children definitely had more unemployment. They definitely had less opportunity to telework, because they tended to be in occupations that were not easily made into telework. So the notion that everybody was at home, certainly people that work for me had this issue. They're all at home with the kids doing crazy stuff where they're supposed to be taking, school lessons, and they're desperately trying to work. Good image, but probably not nearly as widespread as it would seem, because many people just didn't have jobs, or, they still had to go out. If they were going to work, they were going to do it not in the home. But you can see here, and again, we're looking at a long-term trend. The men are in yellow. So this is the total number of employees. And you can see that women had tended not to have as many employees in the non-farm payrolls as there were men, up until, look, right as we get to the end of 2019, women drew even with men. Okay, that was remarkable. Probably we would have spent a lot of time talking about it if not for COVID. But then COVID hits, and what happens? Guess what? We drop down again. Women go way below the line for men. So you can see the blue line at the beginning of 2020 is now below, and then it remains below all the way to today. And that doesn't look like it's that much below, but these are really big numbers of people that are represented there. So yes, women have taken a real punch during this recession, and it remains to be seen what's going to happen, because some of those women, in the same way that people, older people may retire and they go from being unemployed to retired, do not pass go. Well, some women are likely now showing up not as discouraged workers, not as any kind of worker. They're probably now showing up as homemakers. And the question is going to be, what happens from that? What we do know is that if you have younger children in the house, the younger the children, the less telework you're able to do, the younger the children, the more unemployment you're going to have. So, you know, this really is something, and it's always in all of our statistics when we look at presence of children and you do men versus women, children have a much bigger impact on any of our statistics for the women.
Yeah,
Okay,
I'll add on to that as well. It's something I've been tracking for a while. I feel like there have been a lot of news articles about this too. I think the New York Times had one called Primal Scream that really resonated with me as the mom of a young child. In the early stages of the pandemic, things were different, I think, than they are perhaps now. And so that initial, everything shut down immediately. And the immediate response is that somebody has to be there with those children, right? As the pandemic has sort of moved on and progressed, people have found varying ways to kind of compensate. But I think part of that is that schools have reopened in some capacity. And most schools at this point are in person fully. But I think that had an effect on all working parents, but particularly for working mothers. And there have been a number of different studies showing this. And I think one of the components too to think about is that this was particularly impactful for women of color, mothers of color. And that's another aspect of this that I think has been highlighted during this pandemic. And so something worth noting. And now that schools have reopened, the narrative I've been hearing a lot is like, why aren't these women going back to work? And it's not that simple. I think that really oversimplifies a situation. For one, there's a lot of uncertainty still, right? If your child is exposed to COVID and they're not vaccinated, then they have to quarantine for 2 weeks. You can't just keep calling in sick to work because you have to stay home with your child. So that's certainly one aspect. Childcare centers, many childcare centers closed and have not ever reopened. So there is a serious lack of access to childcare for many working parents. And so, and even informal childcare, like having a grandparent watch a child, became very risky with COVID, right? Like we don't want to make grandparents sick hanging out with unvaccinated children. So that has been problematic as well. And so just so many different aspects of childcare and education that we've come to rely on have sort of devolved at the same moment. And it's created some significant challenges for working parents, but particularly for working women. We did see mothers in the early stages more likely than fathers to take unpaid leave from their work in order to stay home with their children. Throughout the pandemic, we've seen women more likely to reduce work hours and more likely to leave their job altogether relative to fathers. And so that's just a few different aspects of this as well.
The other thing, then, talking about the daycare in particular, think about if you ran a daycare and you tried to come back into business. There are now more rules. You have to buy more expensive cleaning products. You have to separate. You can't have teachers floating between one classroom and another, which I know when my son was in daycare, that was a big thing, is that, in the morning, it would be classes together, then they get the full population and they spread them out, and then they go back at the afternoon. The cost model, and for many people, it just would price it out of any possibility. And again, that these are generally lower educated people. They're making not that much money. So how much more do you have to pay them to get them to come in? And even then, you may not have enough space to make it worth your while to run that daycare. The other thing is, don't forget, who really generally takes care of older people in the family. So it's not just the grandparents taking care of the kids, but what happens if you're in that, you might have had somebody go to a nursing home or assisted living, and that no longer seems viable. Well, it's not just taking care of children that typically falls to women. So, okay, the next slide. So this is one that just shows women as a share of all employees. And that's where you can clearly see that moment when they hit over 50%. So more than half of the people working, more than half of the people employed in non-farm. That means we do, when we say non-farm, we do not include agriculture. There are a lot of different things with agriculture that don't really fit in with non-farm employment. So we're more than half, and then it just plummeted. So that plummet is not just, oh yes, people were losing jobs. That is as a share of all employees. So we went from a little over 50% to less than, what is it, 40%? I can't see. Yeah, 49%. So, I mean, that was a real decline, and that changed that long-term pattern, and it has not come back as of now. So you can really see the impact on women in this chart. Next. So here's just broken down, and notice that the axis is different on the two, but this gives a little more detail to see just how much bigger the decline was for women than it was for men. And the patterns just really don't move the same way for labor force participation. You know, we really had a major change. The question will be what happens. And since, you know, some things that have changed may have changed permanently. This may not have just been a hold your nose, we'll get through it. You know, if people figured out how they can, you know, and some people may have figured out that it's actually costing them money to go to work. You know, you figure, okay, you know, not only do you have to pay for daycare and you've got to, you know, get to work and you have to buy clothes and you probably eat your lunch out. When they're done figuring that out, they may have realized that they didn't take that big a hit by not working. So if you have people that are, you know, not making that much money to begin with, this may have been an eye-opening experience that changes their perceptions. So will this change? Will things kind of get back to normal and all of a sudden everybody just resumes where they were in 2020? Hard to say. Next. This is for people 25 years and over, which is the prime working age. And you can see that in general, and just, I should have shaded this one in, but prime working age men had that continual going down, you know, kind of from when this starts. So that recession that happened earlier in the 2008, you know, they really have been coming down, whereas women had been going up in terms of their participation rate for a while, which had a lot to do with demographics. Everything that we do is really demographics. So you had a lot of women who had been out of the labor force, which you don't see as much now, and they came back into the labor force, and many of them kind of had to, because the husband divorced them, they died, you know, whatever, something happened, they needed more credits, they needed 40 quarters to get Social Security. So people came back into the labor force later. And so you had these numbers that were kind of pushing up for a while. Then the baby boom starts retiring. And now you see it kind of starts going down on both of them. And they seem to be behaving kind of alike if you look at the tail end, although there's still a big gap between them. And next slide. This really shows what I was just talking about with the older people. This is 55 years and over. And what is remarkable is that when we were doing labor force projections, and the Bureau doesn't really do a lot of projections, but we do. We're the ones that do the Occupational Outlook Handbook. And probably most of you, when you were in like 6th grade, had to figure out what occupation you wanted to do. And you looked it up in the Occupational Outlook Handbook. That's the place that we do projections. And we had projected that people who were 55 years and over would really continue, their participation rate would keep going up. And even people who were 75 years and over, they were still projected to go up. I would posit that that is probably going to be revised the next time we do it. And you can see here, you know, women have been going up and up and up. The older women were really coming much closer to men because the men had been going down at the same time the women were going up. And now that those numbers have, you know, stabilized and are going down slightly. And you would think, you know, the stories you hear about, you know, the school bus drivers, how many school bus drivers were really retired people or people who had lost other jobs late in a career? You know, You lose your job as a steel worker and you're, 60, you're not going to find another job as a steel worker probably, right? So people went in and found jobs as school bus drivers. They're needed all across the country. And it works for a lot of retired people until, first of all, they lose the job when students aren't going to school anymore. And then you start thinking about it. The kids aren't vaccinated. Maybe the kids were, maybe you were annoyed by the kids to begin with, but over the course of, time, maybe you've decided you really are retired. You're not going back to do it. So I'm sure there are a lot of people making their personal calculations for what it is they're going to do. And their calculations mesh with the situations that are out there. And then when you add up all of those personal calculations, you get broad-based patterns. Okay. I think that was the last one. Am I right? I've lost track. There are some bonus ones at the end that I'm not going to go into. But if anybody wants copies of the slides, they can just email me and I will send it to them. But I think that's the last one, isn't it?
Perfect.
Okay.
What role does legislation play in the labor shortage? Does public policy play a role in sustaining workers' rights and benefits in the workplace? These policies do offer more support to the working population. Do we expect to see an increase in those joining the workforce, Dr. Crispin?
Yeah, so I've been thinking a lot about some different policies. So I think that, the way, for anybody that studied history, the way that we got out of the Great Recession, a lot of that was through infrastructure, right? Government funded infrastructure hiring. And so I think it's very interesting that, the infrastructure bill just was passed. And I think that's going to be very interesting to see how that plays out. I think some of what we're seeing, similar to what Maureen just talked about in the data, is just that we're in a really weird moment where we were in more of a service economy, and then we overnight switched to more of a goods economy, right? Where everything we were buying more or less was services, and then we can't go anywhere or do anything. So now let's just buy a bunch of stuff, right? And so that's just created this weird situation in the labor market where the jobs that we had were not the jobs that we needed. And now we're coming out of that and we're all like, starting to, go to restaurants again and go, Broadway is back and all of that, right? So like we're slowly getting back into that service economy, but we're not there yet. And so I think, that's not necessarily a policy. It's just going to take time to figure out where we are and, how long it's going to take to get there. I think that some of what we've been talking about has particularly affected low wage workers. And we've been hearing since, I don't know, my first year at St. Joe's was the first year of the Fight for 15. So 2012, we've been talking since 2012 about the Fight for 15 and increasing the minimum wage to $15. And I talk about, when I teach labor economics, I talk about this a lot. The minimum wage hasn't changed since 2009 at the federal level. It's still $7.25. And I do think that now is a really good time to talk about where the minimum wage should be at the federal level, but many states have already taken it upon themselves to change their own minimum wages. But I do think part of what's happening is just that many jobs, like working in a restaurant, working in a grocery store, they're inherently riskier now. And you have to compensate people to take on additional risk. And the minimum wage is not compensating people for that risk. So we're just going to have to wait and see. And that's just a natural labor market adjustment in many cases, right? Like that's just how the market mechanism works. And so we're going to have to wait and see how that plays out as well. Some of this is just going to take time. But increasing the federal minimum wage, I think, is a policy that, at least adjusting it for inflation, is a policy that I think is certainly worth a conversation. As we talked about women, this pandemic, unlike previous recessions, the pandemic recession has been particularly impactful in a bad way for working women, particularly working mothers. And so having a conversation about affordable and accessible high quality childcare, that is, I think, one of the biggest challenges in getting back to work for many at this point is having access and being able to afford childcare. And so having something available, I think would help a lot of working parents in general, not specifically women, but I think it would help many women. And then I think workplace policies, it's not necessarily a legislation per se, but workplace policies. Paid sick leave. I am very much hoping that what comes out of this pandemic is that people stay home when they're sick. I hope that we are having a cultural shift, right? You don't come to class when you're sick, when you're coughing and you've got a fever, like just stay home. Don't come to class. Don't come to work, because I feel like prior it's like, just take your Dayquil and get back in there, right? I'm hoping, but many people can't afford to stay home because they don't have paid sick leave, right? So I'm hoping that we see, not necessarily, again, this doesn't have to be federal legislation. This can be corporate policy, right? It doesn't have to be, something done by the government. It can be employers reflecting that this actually is in the best interest, right, for their employees, right? Stay home when you're sick so that everybody doesn't get sick. I think that's a good policy. Paid sick leave, and then I think work flexibility is really important to consider. And again, this doesn't necessarily have to be federal policy. It can be corporate policy. And as Maureen said, it's not going to be that every position and every employer is able to offer, remote work or something like that. But the more flexibility there is in working conditions, the more benefits there will be to employees. And I think we're seeing many employees quitting their jobs or not taking new jobs because of that flexibility component. And so we're at a time where there are so many job openings and we have these labor shortages. Workers can be a little bit more demanding about what job characteristics they have. And I think that's going to be one of them. And then another aspect that I mentioned at the beginning, many low wage jobs in the United States have historically been filled through immigration. And because of COVID, it's been this bizarre situation where, regardless of where you fall, politically, lockdown because of the pandemic, right? So that, again, some of this is not necessarily a policy so much as the situation necessitated something, right? And so some of these things I think are going to naturally play out on their own as we see more vaccination rates growing globally. Then we're going to see some of those immigration restrictions being lifted globally. We're going to start to see workers being able to immigrate and emigrate, right? It's both. And we're going to see more of that international travel. And I think we're going to see some of that flowing through in terms of filling some of these job openings. But again, it all is going to take time. Yeah, it's just like some of this is just going to take time, unfortunately. So, and it's so, as Maureen said, it's so many layers, right? There's not like just one thing. I wish I could say like, yes, raise the minimum wage to 15 and like everything will be fine. It's not that. I think it's so many different things layered, and some of them just have to do with the nature of the pandemic, right? It's just like, that's how science works. So there's not necessarily anything that we can do other than say like, please go get your vaccine and keep wearing your mask, right? I mean, like, that's all we can do. And just like, as soon as it's safe to get back out, it's challenging because there's not necessarily a policy way to get out of some of this. So it's hard.
And there's also, my favorite law, the law of unintended consequences. So, you do something that, we're going to fix this.
Yes.
And in fixing this, you create that.
5 new problems, right? Exactly.
So yeah. One of the things that I think is really worrisome is that, retail jobs are typically kind of, not that there aren't people that make their life working in retail, but a lot of retail jobs are transitory jobs that a lot of younger people that don't have any real experience in the labor market would take. And generally, they're not worth as much to an employer because they have, training issues, and they probably aren't available as much, and whatever, what all the other issues. So what if, which I think it's pretty clear, but given the number of self-service checkouts that I've been going through, what if they decide to use technology instead of people? Well, then the more expensive that the people become relative to however much they produce for the company, the fewer people may wind up being employed. Now that probably, it's hard to imagine how you're going to substitute technology for nursing home workers. Um, Certainly, one of the things where teachers were not previously thought of as being somebody that was likely to be able to telework, but of course we got up to, 78% or something teleworking very quickly after the pandemic started. Went down by about 40 percentage points by the end of the year, but nobody would have even thought they could get into the 40s. I mean, this was crazy. So we've been able to figure some things out. But by the same token, is there anybody out there that thought that was a great way to educate people? So that was clearly, there was less productivity. And yet I expect that when Dr. Crispin's child is in middle school and it snows and they just plump her down in front of the computer and she has her lessons instead of going sledding, there are probably going to be echoes of this that go forward. Some of the technology will work, but there are going to be some changes. And the thing is, it's not always predictable what those changes are. And, who knows? Some of this stuff is really a good idea, but if you don't get the whole social safety net together, people are going to fall off the ends. And if you make things too quick and too draconian, could be a problem. The other thing is that, $15 obviously isn't even nearly enough to live in Philadelphia or New York City or Los Angeles or San Francisco, Chicago. And yet $15 an hour would be a not bad wage in some other parts of the country. So there is, this whole idea that, I hope you got the idea that it depends where you are. It depends what you do. And so do we give $15 to everybody as this is the policy, and then discover that, people are, can live like kings in Mississippi, and we're still having problems in New York and Philadelphia and all these other places. So always difficult. This is why we're the dismal science. The lab is happening the whole time we're living it. You can't just do it on a petri dish and know how it's going to turn out.
Yeah. And I do think one of the aspects of this recession that has been so unique is that although, as Maureen said, there's so many labor markets. I mean, it's so localized, but the way the pandemic worked, right? It's like, well, here's a hot spot, so everything around that is very different than, this other part, and so we could be having unemployment rates in the Philadelphia area of 20%, which is, I mean, that's insanely high. When you think like 4% is where we start to, get a little bit alarmed. Like parts of, Philadelphia, MSA, we were at like 20% for a little while there. Where New York, like just, not even necessarily New York City, but just like the state of New York was at like, maybe 12, right? So like, it was just, even our nearest neighbor was so different. And a lot of it had to do with, where was COVID hotspot, where was COVID trending up versus where was it trending down? It was so strange how all of that was happening, right? And it was so localized, and we'd never really seen anything like that before.
No. And that's where, the demographics of the area, the industries in the area, the occupation, rural versus urban. How dense is the population? The Northeast has much more dense population, therefore dense labor market, than if you go to the South where there are more people, but they're spread out. All those things make such difference. And it's hard to know which effects are going to be the predominant effect.
And related to that, we did see a lot of people leave cities and move to suburbs or more rural areas because, you want to have your yard, you want to be able to like move around a little bit and have some green space. And you couldn't do that necessarily. And so once people relocated, they may not want to move back. And that really shifts where the workers are relative to where the demand is for the workers. And that's like a whole nother sort of mismatch that's just going to take some time to settle. So,
and creates more demand in the new areas.
Yes, but not necessarily the demand for what the workers have to offer. So again, it's another, in supply and demand, labor market mismatch. So and some of this is just going to take time to settle.
Yep.
We only have about 3 more minutes, but before we conclude today's webinar, I do want to ask both of you to share any final thoughts. Dr. Crispin, do you have any closing thoughts?
I think I perhaps have more questions than I have answers. So I hope everyone that's watching has, learned something new. But yeah, I think as sort of as Maureen said, I think at this point, like it's impossible to, look into the crystal ball and predict what's going to happen because so many things have changed in ways that we've never ever seen before and never would have guessed, right? So I don't know what's going to happen. I do think the infrastructure bill presents some interesting opportunities. And I do think that we are going to see changes in the labor market for the better because of it. One thing we haven't talked about, and we don't have time to talk about it, but I do think that it'll be interesting to see what happens with collective bargaining and unionization, because we do see this as sort of an unprecedented time for workers to have some bargaining power. And so I wonder how much of that is going to be a catalyst for collective bargaining. So that's something we don't really have a lot of time to talk about it now, but just put that out there as something to think about as you're thinking through what's going on right now. I do think things are getting better, and a lot of the data that Maureen has showed suggests that things are getting better, and it's not perhaps as dramatically bad as would suggest. But I do think once you dig down, you see it's not getting better for everyone. And I think something to me, as part of, being at St. Joe's, that's where we need to think about social justice, right? That's where we need to think about the mission and marginalized communities. And that's where, while it might be getting better for many, it's certainly not getting better for all. And so that's where we need to have policy focus. And maybe a one size fits all policy is not the best way, but really thinking about what industries need support, what types of workers need support, and how they need support. It's not necessarily monetary. It could be flexibility. It could be affordable health insurance. It could be lots of different things. And so that's, I think, where I'll end it. Just thinking about what a heterogeneous population of workers we have. And who is benefiting and who is still struggling. Thank you.
Yeah. And I would echo some of that, although I have a worry. I mean, I'm very happy that they've passed a bill. I would prefer not to drive on bad bridges. I would prefer not to have lead in my water pipes. I mean, there's a lot of stuff that's urgent. And the sad part is that we tend to not be able to figure out how to do this incrementally. It would have been nice if as the bridges got not good, we fixed them, but we can't manage to do that. But, think about it. We're having trouble getting enough people to work in restaurants. How many people are skilled that can take these jobs? They're building warehouses. They're building lots of stuff currently. So those are the people normally when you have, and your example was correct. How do we get out of the Great Depression? Well, we spent money, we found jobs, the Civilian Conservation Corps, we built stuff, right? We don't have this massive population of people that have been sidelined. Many recessions, like I said, many recessions happen because the employers pull back. And the employers are the ones that are, kind of calling the tune. This is not necessarily the case now. So what will happen? Are we going to have to train people, which would be great because training is something that we haven't really talked about. But the low education issues are really very big. You don't have a lot of education, you don't make a lot of money. You don't have an education, you have a lot of unemployment. So, training people would be a great thing. It doesn't happen quickly. And I think they're still looking for shovel-ready stuff. They want to get this money out there and doing something. But are they going to be able to attract the employees and the employers? Are people going to be able to bid on these contracts with any sense that they will be able to get enough employees to fulfill the contract? So there's so many things, this is like, we need to come back like every 6 months and see where we are, because there's just a lot of stuff that are all coming together at really weird times, not the least of which, as somebody who's, at the peak of the baby boom, we are leaving the labor force. And that is going to be a big thing. And if this accelerated that, it was already going to be a big thing that baby boomers were leaving. If this accelerates it, then that continues to change. Yet another change that we really haven't worked through. You know, that for many employers, the federal government's spending a lot of time because we have serious issues with how many people could walk out the door tomorrow because they have the right age. They can get a pension, and we don't have replacements for people. We don't have people ready to step into the higher levels because we've had so many years where we not only didn't hire anybody, but contracted. We'd let people go, depending upon what administration's in and what they think is a good idea, right? So these are really big problems that have a lot to do with not only what happens in the rest of the world. China is buying natural gas because they're trying to get rid of the coal. And so what's happening? It's going to cost us more to heat this winter because China's got our natural gas. They're global things that really don't have a lot to do with what any particular person is going to put forth as a policy. But those global impacts are massive, and a lot of them stem from, what's happening in the labor market and how are all these different countries going to react to their own labor market issues? How are we going to react to it? And then how does the normal cyclical stuff impact? We've just kind of acted like, oh, it's all COVID. It's great. But, there's normal stuff that happens in an economy that will cause things to expand and contract. Hard to say. Hard to say how it works out. Tune in next year. We'll see what happens.
We'll do round 2, Maureen, anytime.
If I haven't retired.
I'll bring you back out of retirement just to come and chat with me.
That'd be fun. We can do that.
All right. As we close today's session, I just want to remind all of you that a recording of this webinar will be made available at the SRU website under Unlimited Learning Expert Series. And thank you, Dr. Crispin and Maureen, again, for lending your time and, of course, your expertise to today's conversation. And thank you all for your time, attention, and your participation. The next Unlimited Learning Expert Series will actually be held in winter of 2022, so accurately next year. Stay tuned for more information on the SRU website. And again, I'm Luis Nunez, class of 2021, graduate student in the public policy program here. Stay well and have a wonderful week.